Friends, Dr Manish, Dr Satsangi's clinic. Today I am going to take on a topic called hair loss treatment and diagnosis. What is hair loss? What is hair loss treatment and how do we diagnose it? We are normally born with one lakh hair on his scalp. This is all the scientific facts. Now we have a 50 to 100 hair loss. Sometimes you see with the change of weather like these rainy days, you tend to have more hair loss. What makes us bald? So the number one cause is the fall is more, the replacement is less. Number two, very common cause is that you have hair loss, reduction in density, as well as there is a thinning and shortening of each and every hair. That is called miniaturization. So your hair become mini, they become thin, and there is a reduction in density. So all these three parameters makes you look more bald. How do we diagnose? A doctor diagnosis is done as per his medical training. His personal interest in each and every cases is history and intention to take the case seriously and help the patient to recover. So what kind of baldness do we see really? So there are three types of baldness which is very common. One is under androgenic alopecia, that is called male and female pattern baldness. So mostly in male because they have androgen, so a male tend to become bald as per the androgenic process. So there is a M-shaped baldness and you can see the M shape on the scalp. So there is a receding front line and there is a loss on the back part of the scalp. So overall the hair is okay on the sides, but this is the area where you become bald, and this is typically called androgenic pattern. So here the density comes down, there is a gapping, you can see the distance between each follicles. Third, very common is that the front line recedes. This happens in females also. So female undergoes a condition called androgenic hair loss. So we call in male it is called androgenetic alopecia. In female it is called female alopecia diffusa. The second condition which is very common is called alopecia areata. Sometimes you see a patch. Sometimes people undergo a small area completely denuded of hair, which do not have hair growth. So that area is called hair patch. So that patch comes on the beard. That hair patch comes on the brow. Some people tend to lose their brows. Some people tend to have a small areas coming on the scalp for a long time. Sometimes it becomes better on its own, but slowly it relapses back with the best of the treatment. It comes back, and slowly your scalp comes down with the hair, and there is a complete loss of hair on the scalp, and that is called alopecia areata, alopecia totalis, and then on the body parts you lose alopecia universalis. So these are the second category which is very common for the hair loss. The third part is called scarred hair loss. Normally scarred hair loss is also very common nowadays because of the many autoimmune diseases. So what are the autoimmune diseases? Those are the diseases which comes from inside but not are usually infective. Alopecia patch which I have spoken to you last time is because of the autoimmune disease as well as because of the fungus infection called tinea pedis. So sometimes this tinea capitis, there is scalp fungal infections, or the body is having a fungus, so you tend to have a scalp also undergoing a small hair loss, but mostly it comes because of the autoimmune disease. So third category which I told you is called patchy hair loss of scarred origin. So scarred alopecia is where you don't have the roots completely are destroyed, you don't have potentials of recovery. How do we diagnose what is happening on your scalp? Is through a microscopy, that is called dermascopy of the scalp. It tells us about how is your scalp doing. So we can easily pinpoint to the facts that there is a level of increased skin oil. So in such cases we tell you not to apply oil. In some cases I can see that there is a polymorphic hair, that the hair is thin, miniature hair. We see the scales, we can see scarred and non-scarred areas. We see the cadaveric hair. We see black and brown dots which speaks about the prognosis of a case, that the case is a progressive case. So we do the diagnosis, that is called deep hair analysis on the clinic itself. Now how we ascertain that you recover with the level of surety at medical part. So we tend to diagnose you, then we try to understand the clinical findings with the help of deep hair analysis and microscopy. Now the third part is Dr. Satsangis, what we do is to take care of the biomarkers so that we can assure you about how soon you can see a major change on the scalp, whether you can be treated or not, and how we shall ascertain that you are on the right way of treatment, on the right path of recovery. It's called biomarking. So biomarkings are molecules, biological molecules which are present in body fluids, blood or the tissues. So these are very important, essential part of the treatment and diagnosis. So what we do in biomarking is to understand how is your vitamin D25 hydroxy, Number 2, vitamin B12 is one of the very common biomarkers I use. Third is CBC, where hemoglobin, as well as CRP. In cases of a prolonged continued hair loss, we see the CRP also being involved. Now, the fourth is ferritin. The fifth important biomarkers are hormonal issues like TSH we check. We see liver function test in cases of where PCOD is presentation, DHEAS, FSH, and the findings of menstrual disorders is actually very important. And if in case there's a culprit, which is your drugs or drug regimen, we try to see if it is required or give you a special recommendations on same. Now, how do we recover you? So once we ascertain that there is a level of biomarking, there is a level of understanding of your disease, there is a level of diagnosis being done based upon your symptoms and science, then we make a 360-degree picture of your case. We try to tell you how soon you can recover, and once we do it, then we ensure that you are on the path of treatment and the recovery is sure shot. So how do we do it? At Dr. Satsangis, we are bent upon using the natural treatment protocols. So with the help of biomarkers, with the help of the best of the scientific tenets, which guides us physically how to go ahead with the treatment, we take help of the best of the homeopathic therapeutics, essential oils, and natural medicaments. So we ensure that with the help of these treatments, you recover very well. So I'm sure that this shall be enough for you to give the insight that how good it is better to see a doctor, how good it is to take care of your case with your own home remedies, and where you can take a shot and speak with the specialist and come for the supper with the help of a doctor. So I intend to tell you that hair loss is a very common phenomena, but its repercussions are long term, and we recommend you to ensure that you come to us, we diagnose you with the help of our own medical training, and ensure with the help of latest biomarkers that Dr. Satsangi is using a natural treatment to give you full-fledged boost in hair growth, retard your hair loss, and ensure that you are on the scientific, irreversible recovery with the time. So friends, I'm sure that you will be benefited. Please share the video with people. Please share the information that we are into a very scientific treatment, and it is for the people to use the qualitative phenomena at Dr. Satsangis rather than to take a shortcut of a treatment. Come to us, we will surely help you to recover your hair. And आपके अंदर बैठे हुए ईश्वर को मैं पुनः धन्यवाद देता हूँ. All the best.